if you feel like you have hip arthritis, then you're going to want to listen to this, because we're going to talk about 2 common signs that we know could potentially be, yes, you have hip arthritis and you're probably going to need surgery. But we're also going to get into things that mimic arthritis that's not coming from arthritis of the hip, as well as some things to try. So first, let's talk about what it can feel like. A lot of times when we have that hip arthritis, you're going to have pain. It's going to go into that growing area, in through the front part of this hip. It's very, very common to have some issues there. Typically hurt to put weight on it. A lot of times you'll hurt to even like sit, because it just doesn't feel good in most positions. And you may even feel like if you've been sitting for a while and then you try to stand up, that you want to kind of limp because it feels like your leg's going to give away. So these are common things that we can see with hip arthritis. But really, when we look at people, what we're going to look at is, how does the hip move, and do you hear grinding? Now, you may have some popping and clicking. Those things are completely different. But if it feels like a grind and you can feel it and you can hear it, it's the most common joint. We'll hear it in the knee and we'll hear it in the hip. And if we're moving you into different positions and you hear like it's a grinding sound and we can feel it, you have arthritis in your hip, and physical therapy is not going to help you. Other things that will happen where people can have that arthritis in the hip, if they don't have grinding, but they do a round of physical therapy, when you get to someone that's really good, and it just doesn't respond well. We've had a few of those clients where we took them through some sessions and they literally were not responding to anything that we were doing. Those cases, and they're still having issues with walking and sitting and all those kind of things. We've had some patients that we've had to be like, yep, let's go to the doctor. I'm pretty sure that's probably what's going on. And sure enough, that's what it is. And they had to have a hip replacement. But there are things that can mimic a hip arthritis. And so one of them is really common. It'll feel like it'll like arthritis, but we're really not sure if it is. So when we start asking people like what makes it better and worse, they may say things like, yes, when I sit for a while, I get super stiff and it hurts. And then when I try to straighten up, it doesn't feel very good. I feel like it wants to give away. But as I start walking and moving a little bit, it starts to feel better. That's a common thing that we see, what we call those like hip derangements. That's when we are in these repeated patterns in our hip. And if we're doing these repeated patterns, like we're always bent in this position, we're walking, we're always here, and we don't take the joint in other different positions, very common as we get older, because what do? We sit, we stand, we walk. Like we're always in the same plane, and our leg is always moving forward in this position. And so what can happen is you can create these pathways in the joint, and you can have parts of the joint, because you're not moving it in those areas, that get stiff. And it's really common for things like that to, sitting bothers me. When I stand up, I feel like it wants to kind of give away, but as I keep on walking, it feels better. Those are cases that probably not hip arthritis, because it would feel worse as you keep on walking and putting weight through it. It's not going to get better because it's just an inflamed joint. So what are some things that you can do if that is the case? So there's a lot of different positions that we can put people in, and we always want to ask questions like, what makes it better? What makes it worse? And when they start saying things like bending activities make it feel worse, but standing and straightening or stretching the joint, as you notice, like I do stretches and I kind of stand and kind of stretch that joint, I start feeling better, then we kind of have an idea of which direction we need to go in. And you can have limited range of motion and like knee bent, like bringing the knee to the chest. You may be able to, if you're lying on your back, one side can go really far and then the other side doesn't move as far on the side that hurts. You can also have it where you can't move this leg as far, but this side can go a lot farther. When you see like that there's issues with a little bit of rotation and flexion, a lot of times we want to add that rotation into the stretch. But sometimes if we just go into a little bit of a hip stretch, which is what I'm going to show you now, that's going to be really gentle, we can kind of see if it improves the range of motion. So what you'll want to do is go on your back and kind of test it. Test the motion. See how far one joint can go versus the other and push it. And if you're like, ooh, that's a little stiff there, I can't quite go as far, then we know that there's a little bit of limitation there. Keep that in mind. The other thing we can notice is that, you can sit and do the figure 4 stretch and just see, can I move the other side as far? Nope, this one doesn't move as far. So what you're going to want to do is just kind of remember those baselines. And here's where we're going to stretch. So you're going to take your foot that's bad and you're going to put it up on your bed. And one leg is going to be off the bed, one leg is going to be on the bed. And you're just going to kind of push up gently just to kind of stretch that hip joint. So remember how I said when we do similar patterns, parts of the hip joint actually get tight. Well, we're stretching the hip joint. You're going to feel it in your muscles too, but our purpose here is really to kind of stretch the joint. And so we're just going to kind of stretch it here, and you're just going to hang out and you breathe. As you breathe through this position and kind of hang out here, you're going to feel it kind of go down. You're going to feel it stretch a little bit more because of that breath. So after you do this for about a minute, you're going to come up, stand up, kind of move around a little bit. And what you're going to do is you're going to lie on your back and retest those motions. So come back here, kind of test it, and you're like, oh wow, that might feel a little bit better. That's a great sign. Or you move your leg and you're like, oh wow, that moves a little bit better. Those are really, really positive signs that this is going to be something that's going to really make a difference in helping you. So we always say the first phase of physical therapy is you've got to look at the mobility. How do the joints move? Compared to like one side versus the other side. They should move pretty similar. And if it doesn't move, it doesn't matter what strengthening you do. You physically can't move into those positions. So phase 1 is improving the mobility. This is a mobility exercise that I just showed you. Phase 2 is now that we have the motion back, now we need to start activating the muscles that haven't been working very well. And so that's the other thing that is another thing. If you have muscles that are tight, that are kind of stuck around the joints, if you improve the mobility, some of that will improve. But if it doesn't, then we've got to release some of that tightness, because anytime you have tightness around the joint, that also is going to produce pain in that joint that can feel like arthritis, similar in the knee. And so if we have a lot of tightness and we release that tightness, we should start feeling better. If we don't, and the tightness keeps on coming back, we've got to go into, okay, why is the tightness there? We've got to look into other things. And if the tightness keeps on coming back after we release it and the mobility is improving, we start looking at other things like we've got to work on some strengthening so that you're not using the muscles wrong. And there's other videos out there that I show you that you can work on strengthening, specifically those hip extensors that are in the back and the adductors that are in the front. And I'll make sure those videos are actually in the description so that you can check those out as well. But that's really where it is there's two main things that we look for when someone has arthritis. The biggest one being there's a lot of like crepitus, like it's like grinding type sounding. That's a pretty big sign. And if you've just had failed treatment and you're continually having pain and the muscles are continuing to tighten up after looking at mobility and the strength, and you're still having those issues, that's another issue to go like, yes, let's go get this checked out and just make sure that you probably have some arthritis that's happening in your hip. Again, my name is Stephanie. I help clients avoid surgery and injections. We often see things that mimic things that really aren't what they are, that they actually can be helped to really get you back to living your best life, and that's really what we do. Make sure you subscribe to our channel because we put out content all the time on various things.